So yes, it's a girl need to be treated. So far, so good. Uh-oh, I hope the baby in like her. Oh, she all right. Okay, so now, here we go. The word for that, for what she now has, and it'll be in her chart just like this. She has latent TB. Latent. Latent means no signs and symptoms whatsoever. That's what that word means. Okay, latent. Not late though. Don't, ooh, please don't get it. I have people get it confused with late. It's not late, it's latent. And late has a completely different meaning, so don't do that. Okay, so latent TB means I have been exposed, but I don't have the disease. And what else does it mean? Is she contagious or not? No. Does she have signs and symptoms? No. Does she have to go home and freak her family out? No. Now, how long is she going to be treated?
3 months.
3 months. It's her business. Go home, get yourself treated, and get on out of here. Okay? Now, what if the patient comes in coughing and blowing and going and hacking and snotting and whatever else? What if that patient came into your occupational health talking about, I need to get a TB test? Where should you send that beloved soul? To their damn ER or urgent care or their doctor. Get them away from you, first of all. I mean, they could have just had a flu. But they want a TB test, coughing and blowing and hacking and going. Nah, I don't think so. Because you're going to waste their time. And they're going to think they're fine and disappear for a couple more days when they should be treated somewhere probably isolated. You don't know for sure. I mean, you don't isolate them until you have active lesions on the x-ray. And that's what that person needs. They need an x-ray and some sputum cultures. But that ain't your job. You're an occupational health nurse, remember? You don't do it like that. Get the fuck out of my office. Nicely, right? Baby, yeah. I'm gonna need you to put this mask on. And if you're thinking that you have TB, I'm a little worried about that because you are coughing and you may indeed have it. But if that's really true, honey, you need an ER and you need it now. You see where we're going with this? Because there ain't shit I could do for you in this office. Okay? All right. Okay, so you got it. That was a lot. And that was just like one little thing, screaming. The disease itself, you see this man sitting on this exam table. You see how he looked. He look a mess. The only good news about how he looks is you don't have to write a lot because it's already written. You wrote a lot about the test, but you got to write a lot about the disease. This is not latent TB, is it, y'all?
No.
What is this called?
Active
TB. So, bruh man, looking all hot and messy. He is active TB. And he has some classic signs and symptoms. Now, your tests love to separate early versus late. If we look at early symptoms of TB, you're going to have a low-grade fever. Highlight it. Don't write what you can highlight. Remember the road. You're going to have a low-grade fever. You're going to have anorexia. What does that mean?
No appetite.
No appetite. You're going to be fatigued. And you're going to have a cough. So far, so good? Okay. Those are just your early symptoms. That cough is very important. That everybody named mom-in-law know is productive. My own patient told me that this cough was not TB. That's what she told me. And now I don't know whether it was or not. I hadn't diagnosed her yet. But she did say that. She said, I know for sure it ain't TB. Now, she was a nurse, and she's a travel nurse. No, it ain't TB. I said, how you know, baby? Well, because I done had it for months. Oh! So she was under the assumption that TB hits you upside your head so hard, knocks you on your ass, and makes you show up in somebody's ER. No, it don't. Look what it say. Chronic cough. Y'all see that? That means you've been coughing for a minute. Okay, that's kind of like important because I'm gonna tell you what doctors do. They work your ass up for pneumonia and don't think about TB. They don't even think about it. They do not think about it. They work you up, they do swabs for it, they never really think TB. They just don't. They don't say rule out TB on nothing. It be usually the nurses be like, make sure you check them for TB. Make sure you send a sputum culture for TB. Because the only way to diagnose, and you got to put this in all capital letters because y'all get this wrong every day. The only way to diagnose TB is sputum culture. That's the only way to diagnose it. If you get on this test talking about the way you diagnose TB is X-ray, I'm going to beat you and pray about it later. Okay, so you must know it's all about the sputum culture. The same is true for pneumonia. If you get on this test talking about the way you diagnose pneumonia is a chest x-ray, you're going to get a beating. No, it's not. It's not chest x-ray. It's a sputum culture. And these are the two diseases on your test that you kind of mess up a little bit. Okay, now, bruh, man, here we go. Let's give you some late signs because they're pretty bad. Weight loss. You see the chest pain and the weight loss is already on there. Just highlight. Don't write what you can highlight. So the weight loss is on there. Put late. Chest pain is on there. Put late. Hemoptysis is on there. Put late. What's hemoptysis, y'all? Coughing up blood. Very good. Don't say throwing up blood. That's hematemesis. This is coughing up blood. Hemoptysis. Y'all good? Okay. Now, the chronic productive cough, when it's late stages, he's going to take a whole box of Kleenex and use them in one day. That's how productive it is. So it's kind of like extreme. Like it's like, oh my God, what's wrong with these people? So I had a lady at work I was taking care of, and she was really coughing. Well, they tested me for pneumonia and said it was negative, and they did an x-ray and said it was clear, and they did this and they did that and they did the other. Did they test you for TB? No, they didn't do that. I think you need to call your doctor and tell them you need a TB test. You think? I do, sweetheart. I really do. I got a caregiver celebration. She had TB. She sent me a caregiver celebration, which is like writing into the hospital, thanking somebody on a little scanner thing. No one had tested her, and she said she'd been coughing for 6 months. This is a problem. What else could it be? It's got to be TB. You don't cough like that for all that time. And she never smoked, so it wasn't COPD, right? Remember, COPD is a chronic cough. But I mean, you know, you gotta smoke for that one, okay? Or live with a real bad smoker. So think about it whenever you're in the field and you're thinking, well, damn, she said she didn't have this cough and been worked up for everything and everything keep coming back negative, and then she just still got this cough. She's like, I know it's something. I ain't been had this cough. It's just been in the last 6 months. It's ever since Charlie died or whatever. So I'm like, okay, look, just suggest that they test you for TB. You're not going to believe this. That lady diagnosed me. Tell her thank you. I mean, she sent it to the boss, but it turned out they tracked it. It was me. The nurse told me I had TB, and I did. Yeah, kind of simple. Now, so night sweats. Night sweats are going to be more in the middle. It's not in the first stage. It's not in the last stage. It's definitely in the middle. It's not going to be real late. It's definitely a common sign, night sweats. Please don't forget this person's exhausted. Now that nurse I told you about, my actual patient, that was my patient. She traveled, she was coming from California when she came to see me. She traveled for a year like that. She told me that. She's like, never in my wildest dreams would I have thought that was TB. I'm like, yeah, that cough been lasting a while, baby. Okay, she had just chronic cough. All right, now, when it comes to active TB, you guys are smart. You already know what I'm going to say. You've got your sputum culture. You've got your chest x-ray. Maybe you don't know this. I don't want to assume that you know this big old fancy $4 word. So let me write it down. The sputum culture is going to come back for myco, not micro, because y'all be messing that up. Think Michael Jackson, not micro. Mycobacterium. That is the actual infectious disease. Mycobacterium. That's what the sputum culture is going to be positive for. And they're going to do that sputum culture and it's going to come back like that. It's going to take a while to come back. It's going to take a couple weeks for the final result. On your test, when you mark the requisition or choose what you want in the EPIC system for the test, it's going to be called acid-fast bacilli. You definitely want to know that. Acid-fast bacilli. So far, so good. This is what you will check off with asking for what test you need to test them for it. When it comes back, it's going to be positive for Mycobacterium. Not micro, myco. Mycobacterium. Now, the chest x-ray is going to be important, but it's confusing. So you got to listen up. So, coughing and whatever else got sent for a chest x-ray and then ultimately diagnosed with this. So the chest x-ray. You need to know that this is what will be on the chest x-ray. Cavitations. Sometimes you get lucky and it'll say on your test something about active lesions. Okay? Cavitations or active lesions. That's what it'll say. Yep. That's what's going on. Yep. So when COVID was out, and we knew it was COVID, nurses that worked in it would see opacities on in the lungs. That's what that one would say, opacities. If it's pneumonia, it'll say consolidation or crackles or whatever. You'll hear crackles, but it'll say consolidation on the x-ray. So just side note, but this one is a big one that you have to know, cavitations. It's even on UWorld. Okay, so now a common question is, what is your first nursing action? When the patient comes in with a chronic cough and shows cavitations on the chest x-ray, what y'all gonna say?
Airborne.
No, you're not gonna say that. What y'all gonna say?
Get the hell out of my face.
I love that. Let's see, hold on.
Emergency.
Private room.
That's the answer. Say it loud.
A private room.
Yeah.
Now, here's what I'm trying to get y'all to know. Hold on one second. Okay, so listen to this, because it's really important that you don't say airborne. All of us would think airborne, but here's where the test is going with that bad answer. Because, I mean, it is the answer technically, but it's not really if you think about it. It's kind of like what we did when we talked about walking in the room with pedals for your first nursing action for VFib. Remember we said it's not the rhyme. It's actually not, because you didn't walk in with paddles. And so since you don't walk into the room of your patient with paddles up ready to shock them, The first nursing action with VFib was actually chest compressions. Remember that? Okay, this is the same thing. You don't want to say your first nursing action is airborne because technically it takes a minute to find a negative pressure room with and private and all this other nonsense that goes with it. You need to get them isolated immediately. You don't have time to wait till admitting gives you a negative pressure room. Does that help? So therefore, you say on the test, isolate them in a private room. That is your first nursing action. Get them away from everybody. And later down the road, you'll get the room. Believe me, you'll get the little airborne room or whatever. But airborne actually requires quite a few things set up. Think about what we said about the PPE. That's outside the room with the cart and the little hanging thing. And then you got to go get your mask, your fitted mask and all that old dumb shit. I mean, it's deep. Okay, but for right now, they need to go ahead and get in a room by themselves. You need to slap some type of barrier on your face so you can hurry up and reach you at 1095. Okay? Because it's still going to be a barrier. This damn thing, don't play it cheap. It's still a barrier. It's all you got right now till you can get to your, because you know, N95s is just not sitting out there everywhere. You got to go get it. Okay? So that's why they say that. And they may say it differently. They may say it like this. The patient's sputum culture comes back positive for mycobacterium. Oh my God. There you go. Get this patient away from everybody. So I don't know if they're going to say this or that, but it's all the same thing, right? The only one that's not true is patient's test came back positive PPD. Well, you already know. That's just a screening test. She might need a little chest x-ray, of course, but she's not contagious. Remember, if she ain't coughing, she can't get you. Okay, she's not an issue for you. That's hard to remember because I still see nurses act crazy. They be like, she had a positive PPD. I don't want to take care of her. Shut the fuck up. Stop it, y'all. They just be clowning. I have to get my people straight at work all the time. They came up to me yesterday. What did they ask? It was a good question, though. One of the department secretaries for one of the doctors came up and said, Shelly, what are we doing with COVID nowadays? I said, well, the good news or the bad news, depending on how you want to look at it, is we treat it no different than the flu. What? You mean to tell me they can just come on in here? They really can. As long as they've had 24 hours of no fever, we treat it like the flu. And that's because nobody knows what? The CDC guidelines. What did she say when she looked them up? I couldn't find them. I said, I know, baby. Your president did that bullshit. Okay, so she couldn't find them. I mean, this is the doctor's secretary trying to talk to a patient. Should she come in or shouldn't she? Wow. Don't know the guidelines because you can't fucking look them up. It's really sad. Okay, now, so here we go. If you look at your paper, you have to be careful because there's a bunch of shit at the bottom. At the bottom, you see it says TB medications for 6 months or longer. That's true. Then it says decrease activity, which basically means rest. That's true. Then it says respiratory isolation until negative sputum culture. I don't like how that's written. So let's talk about what's going on. The patient is going to be given 4 medications. You kind of got to know that. The mnemonic for the medications is on the next page. Ripe. The banana is ripe, right? Ripe. Okay? Those 4 medications, once the patient has taken them for 2 straight weeks, that's a long time, then restrictions can kind of be lifted up. Okay? So we don't, if they're really sick, we keep them with us for 2 weeks. But if they're not, they go home and they're not allowed to go to work until they've been on these meds for 2 weeks. 4 meds, guys. Now, PZA is given, pyrazinamide is only given for 2 months. Make sure you know that. And you need a whole lot of water. Everything else is going to be given quite a little while. So on that page with all the medications, you have to remember that all of these medications come with a whole select all list of stuff you got to know. The most important thing that you're going to have to remember about these medications is all of them just about decrease your absorption of vitamin B6. So technically, your mnemonic is ripe B6. Because it's actually 5 things they got to take. I had a student who was diagnosed with active TB, you know, and she was not told anything about vitamin B6. In fact, she was 19 when she was treated for TB. Now she's in my class, 20-something. She's in nursing school. I mean, she's graduated from nursing school, about to be a nurse. She hears me teach this lecture and I talk about the B6. And she's just listening and I don't know anything about what she's doing. I don't know any of her story yet. I'm just talking shit. You know how I do. Go stand up here and talk all kind of shit. So I say in the class that the TB medications will literally cause you to not absorb B6 and cause you to come up with a B6 deficiency. That's why you have to take supplements. And the way that would feel would be very painful because that's called neuropathy. I explained you would be feeling tingling, numbness, pain in your extremities. You would get these Charlie horses and these cramps. She was pissed. Remember how long you got to treat this? 6 to 9 months. She had 6 to 9 months of severe pain. And it got worse every month because she didn't have vitamin B6. She was pissed. How could they forget such a thing? That's like terrible. I didn't know what was wrong. I thought it was the TB itself. Nope. Pain is not part of TB unless it's in the chest. Coughing is part of TB. That pain that you experienced was the B6 deficiency that you had because these numb nuts didn't tell you what you needed. Just unbelievable, the stuff you hear. Now, these medications, let's do our select all list. You got a little room at the bottom. Let's make a list of stuff. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. So we're going to do it at the bottom. And if you look at the bottom, you got about 1 inch of stuff at the bottom, inch of space. So you need about two columns or something, but whatever. So let's go. Number 1, take it in the morning. Take an AM. Keep your life simple, abbreviate shit. Take an AM. Number 2, empty stomach. Number 3, liver function test, LFTs, liver function test, LFTs, before treatment. So B, letter B, the number 4, before treatment, RX. Hey, you down there with 2 letters on your paper. You've been said all kind of shit. So let me show you what I mean, because I'm sure if they play the tape, they can be like, what she said? So we said take in AM, empty stomach. We said something before, liver function test before treatment. Boom. Okay. Number 4, No Tylenol or alcohol. Notice how they rhyme? No Tylenol or alcohol. No Tylenol or alcohol. Now why?
Suppressors. What the alcohol is.
Because the Tylenol and alcohol can hurt your liver?
Excellent, nurse. Woo! Yes, my girl did big things on that one. These are also going to be a problem if your medications for TB are hepatotoxic. We don't want to push it on over the edge and let it be real toxic to the liver. So no drinking during this administration, honey. And Tylenol can be toxic to the liver as well. Okay, so you got your 4. So that brings us to number 5, which is all the meds are hepatotoxic. And number 6, which is B6 deficiency. So you need supplements. Another one is report yellow sclera. Why? Why are you reporting yellow sclera? Yep, that's jaundice, right? So if you have yellow sclera, that means you are jaundiced, which then means your liver has been hurt. So we want you to report that. Report yellow sclera, B6 deficiency supplements, hepatotoxic, no Tylenol or alcohol, liver function test before treatment, empty stomach, taken AM. And then number 8, do not stop antibiotics, right? Take till you are done. Because we don't want your TB to become resistant. Ain't that right?
Mm-hmm.
Do not just stop because you feel better. People do it all the time. People do it all the time. Now, I'm going to write something at the top for high-risk patients. You can write it at the bottom, but I want people to see it. What was it? ODT, OTC, OTD, observation. Oh, DOT. DOT. Direct observation therapy. DOT. Direct observation therapy is for high-risk patients. These are your homeless patients, maybe your prisoners. In other words, people we may not actually believe are going to take the medications as prescribed. So it's called direct observation therapy. We can be the nurse watching you take it, or we can have a trusted family member. So it could be family too. Either one. DOT. Now, you want to make sure you know who is exactly high risk. Like, who is that? Okay? So let's make a list of all the people that are high risk. You're looking at that guy on his chair. Either you turn into the last page with the textbook copy out of it. Wherever you can fit stuff on there. Probably this page because you have some nice chunks of space. That's probably where I wrote mine. This page, you got a bunch of spaces here. You can put all your little risk factors in there, or your people that are at risk in there. But that page is, don't ignore that page, by the way. It has everything I just said. Like every single thing I just said is on that page. Okay. Okay, so here we go. Who do you want to put on our list first? High risk for TB. Homeless. And next to that, just write shelters, because shelters are like you sleeping right by each other. As they wake up in the middle of the night and steal your shit. Been there, done that. Okay, so homeless or shelters, that's one. What else y'all want? Military, no. No, that's skating. Prisoners, very nice.
Hospital.
Yes, us, our asses. Very, very nice. Healthcare workers, prisoners, homeless, shelters, whatever. What else y'all want? Yes, yes. Yep, so we will put immigrants. Remember, the correct term is immigrants. Illegal aliens is some bullshit. Sound like some hateful bitches on some trash. Okay, it's just wrong. Okay, so we got homeless or shelters. We got the prisoners, healthcare workers. We got our immigrants. I'm trying to think, it's one more though. Oh, I know. We forgot, y'all. Look, immunosuppressed. Let me explain what this. Oh, and IV drug users. That's another one. Let's talk about the. I got two more now, and my brain's starting to work for me. I got two more babies. This is number one right here. HIV positive is actually the number one risk factor. Let me explain what I mean by that. HIV and TB are cousins or twins, like gonorrhea and chlamydia. How many times in school, or maybe just in general, did you learn, maybe in high school even, that gonorrhea and chlamydia go together? Like if you see one, you always see the other. That's exactly what HIV and TB are. They go together. They really, really do. So if you think about that logistically, it means that if I get a patient that's positive TB, they are automatically tested for HIV, and vice versa. If I get a patient that is HIV positive, they are automatically tested for TB. They are just joined at the hip like you would not believe. Okay, so you gotta know that. And you gotta be explicit about that. You never lie to patients. So if the patient says, well, what the hell are you testing me for HIV for? I mean, I just have a cough. I mean, like, I thought y'all said I had TB. You explain, well, these two diseases like to hang out together, and I hope you don't have HIV, but it sure would be a good idea to find out sooner than later, because when we find out sooner than later, your life can be as long as mine without it. You see? And that's honest to God truth, okay? So you just explain and just be upfront. It may be like hard for you to say, you know, because you're like, how do I say that? Well, you just say it. You just gotta say some things as a nurse, okay? Like, cause they be looking at you like, well, what you mean? Like, okay. Now it's gonna be even worse after they find out they have it, and you gotta go in there and talk all kind of stuff. Now, so you got it. Homeless, shelter, prisoners, healthcare workers, immigrants, immunosuppressed, IV drug users, and positive HIV is the number one risk factor. Number one. Okay. All right. Now, you have here, if you look, a lot of shit. You have gone over screening. You have gone over latent TB. You have gone over active TB and the signs and symptoms. You have gone over how to treat it, medication or side effects or adverse effects. And then you have gone over your risk factors. Now, I do want to do a tiny bit amount of teaching and make sure I covered my bases. If you look at this page, the parts I want you to highlight, because this is one of those pages, like when you come across stuff like this in your packet, you're supposed to highlight that shit. Don't just cross over and be like, that's too much shit to read. Fuck that shit. I ain't reading that shit. Because that's what y'all be doing now. We know this. Now, so, right. Oh my God. Like, fuck this. Shelly on some trash. I ain't reading this shit. That's too much. Yeah. We have a whole generation of non-readers. And this is scaring me because I don't know how you're going to function later as a nurse, because you do a lot of reading as a nurse, especially charts. Okay, so now look under nursing interventions. You see the little B complex vitamins, y'all? Nursing interventions for INH, you see it? The third column, just highlight your little B complex, make sure you know. Do you see where it says avoid drinking alcohol? Oh, there's another side effect we forgot. That's why I like to go over this. What color does INH turn your, I mean not INH, but what color does rifampin turn your urine?
Orange.
Orange! There you go. But does it just turn your urine orange? No, it's contact lenses, it's sweat, it's your saliva. It is wild. Okay, so where you see rifampin, I want you to go ahead and highlight that reddish orange on there. Let's see, where is the reddish orange? There it is, reddish orange. Reddish orange. It's under nursing interventions. If anything says nursing interventions, it's on your test. Okay, so you teach the patient, it may turn her urine reddish orange, and it will stain anything liquid. So if you sweat, it's gonna be orange. You would have wore a little cute white tennis outfit, you and your man going kicking it, and your little white skirt around the waistline is now orange because it was hot and you were sweating. That's real talk. Okay, or your contact lenses or whatever. Okay, now look at what it says under there. It says teach women using oral contraceptive. They may need another method. Highlight it. Y'all see it? Okay. Same thing. It's right up under the little orange urine. And then here again, it says no drinking alcohol. See how many times it say that? And then it says call if you have yellow sclera, the whites of your eyes, blah, 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 right? Also notice how each paragraph that talks about call us if you have yellow eyes also has in there call us if you have bleeding or bruising. Why is that? Why would you need to call me if you have bleeding or bruising when you're on TB meds?
Your platelets is high.
Because your liver controls clotting. And if your liver is becoming toxic, if this medicine is making you have hepatotoxicity, you're not going to clot. And so now you're going to see bruises and you're going to bleed more. Your periods will be really, really heavy, outrageous periods because you're now toxic. Okay? Now, if you go down a little bit further, you'll see this pyrazinamide, which is called PZA. It increases uric acid. That's the problem with why you got to push fluids. It increases your uric acid. Do you see where it says, ask the patient if they ever had gout? Mm-hmm. Gout is a high uric acid. Highlight that gout, y'all. That's under nursing interventions. Ask the patient if they had gout. Okay. Then this particular medicine, if you look, it says sunscreen. Y'all see that? Okay. Ethambutol is safe in pregnancy, and the thing you had to remember about ethambutol was color vision. It could make you colorblind. Do you see where it says tell the patient report any changes in vision such as reduced color, color vision, blurred vision? But it's all about the color vision. So ethambutol is all about the color vision. Y'all good? And all of it say push fluids, don't it? You just gotta drink 8 ounces, whatever. So that's a lot, y'all. That's like a lot that they like to give you on this test. And you can see where it's a list of stuff, okay? Don't forget the liver function test before treatment. You already wrote that on the other page, okay? Don't forget that, because every single one of them categories says, you know, it could cause your liver to be toxic or whatever. Okay, that is TB, and that's a hard one. So we're done with that. Yay. Now, I want you to go back to your pink packet, because the pink packet is your test. I wanted to give you that extra love on TB